I'm Dr. Ange Mack. Welcome to Your Health, It's Personal. This show is designed to describe integrative medicine and healthcare therapies to help people understand the benefits of how these work so you can live your best life. Today we have with us Dr. Christopher Leet, a cardiologist. Welcome, Dr. Leet. Thanks for being on the show with us.
Thank you.
And this is exciting for me because this is my very first show around integrative medicine, whole person healthcare, and the therapies that go along with that. So I appreciate you being on with us and helping me introduce this to our public and our viewing population in front of a live audience. So anyway, tell me a little bit about your background. 35 years in your own practice that you founded. Tell me a little bit about that.
Well, yes. I mean, I obviously had a very high-tech education leading up to all of this. So I've practiced in the Manassas and Warrenton area for 35 years. Eventually, I retired, and I'm enjoying that. The main thing that happened that we're talking about today really is the fact that I actually had a heart attack myself.
Yeah, that was going to be my question to you. What, because you practiced for 35 years, and then during your practice, were you coaching people on, directing people on how to live healthier lives and look at nutrition and stress release, or did that come after a personal experience?
Well, of course, I was always talking to people about what they need to do. But I had also educated a lot of the hospital personnel about how to take care of acute events like this. And so one day, in spite of all of my high-tech learning and all that, I had a heart attack. Actually, I had it right in the hospital.
Well, it was a good place to have it if you were going to have one.
It was.
Yeah.
But there were a lot of other interesting things that happened.
Okay.
For one, I managed to witness my own cardiac arrest. And that's not something I would ever wish on anybody.
May I ask, how old were you when this happened?
51.
You were 51, and how long had you been practicing medicine at that point?
It had been about 20 years.
Yeah, so you were 51, so you're relatively young.
Yes.
Yes.
And I had a family history, but I was also overweight. I was under a lot of stress with a very busy medical practice.
Okay.
And
not unlike so many physicians.
Right.
Yeah.
And actually, I found out along the way that between 50 and 60, actually, on a bell curve, that's sort of the peak time that people have their heart attacks at. And in men, at least, it's the same sort of situation where they're worried about their job, they're trying to make their job a success, they're trying to put away money for retirement, and they're not thinking about taking care of themselves.
So you kind of found yourself in this scenario at 51, and you witnessed yourself having a heart attack in the hospital. What were some of your symptoms? What did you know, like, immediately what was going on, or did you just kind of? I mean, I would imagine you would. As a cardiologist, you didn't blow them off. It's like, oh, it's just stress. It's like you knew what was happening.
Actually, there were lots of stories told about that because I actually ran my own electrocardiogram in the office when I was feeling bad, and I saw just enough to see that I was having a heart attack. So I got my office staff to take me to the hospital, and while I was lying in the emergency room, I was trying to just look at the monitor and behave myself because I knew what was most likely going to happen. And I saw my heart develop what's called ventricular fibrillation, which is cardiac arrest. And I was the first one to see it, and I tried thumping myself on the chest, and that didn't work. And I knew that if I didn't do something in the next 10 seconds, I was going to be out.
Right.
And nothing worked. So the last thing I said before I lost consciousness was, "Girls, look at the monitor," because the nurses were all right around me.
Okay.
And then I passed out. And I woke up down at Fairfax many hours later, having had a couple of stents put in my coronary arteries. And so after that, it was a matter of recovering from all of that. But the thing that got me into integrative medicine was that I went through a PTSD a couple of months after the event, and I found out that that's actually typical. It doesn't happen right away.
Right.
It happens 2 or 3 months later.
Well, let's talk a little bit about integrative medicine, because that's what this show is based on,
Yeah.
integrative medicine and whole person care. And for those that don't know what that means exactly, integrative medicine and whole person care, it's a new term that's a kind of a buzz term these days, but it's looking at the person holistically, looking at all the factors that could potentially influence someone's health, and also looking at all the systems within your body, knowing it's not just the heart, it's the kidneys, it's the liver, it's the endocrine system, it's all these systems and organs working together. And there are multiple ways to help someone heal, get in balance, and feel better. And it doesn't always have to revolve around pharmaceuticals and surgery, though it can. But we look at prevention in integrative medicine, like nutrition, like stress release, activity, those types of things to prevent. And with cardiovascular symptoms and disease, those can actually be reversed as well. But that's not what got you into integrative medicine. What got you there was the PTSD that happened 3 months or so after the event.
Yeah.
Tell me more about that.
It was just when I thought everything was going fine, all of a sudden then I had a panic attack, and I had a series of strange dreams at night that just kept going and going and going.
They were waking you up, and yeah.
They didn't wake me
disconcerting.
up, but when I woke up in the morning, I felt dragged out because
Sure.
I'd been having them all night. And after this happened, 4 or 5 days, I thought, my God, this is depression. And so initially, they wanted to put me on antidepressant medications, and they did for a little while, but I really didn't like that. So what I did was look around for other things to do, and that's when I got into meditation and yoga. And I went around to, there wasn't very much information about any of this around, so I had to go around various places.
It was about
in
20
the
years
area.
ago or so.
Yeah.
And you were looking at yoga for stress release, meditation for stress release. So that's
Yes.
kind of you started engaging in what can I
Yes.
do for myself? I don't necessarily want to be on these antidepressants and
Right.
medicines, because you knew that there are other ways. There could be other ways to help
Right.
you with this.
And it actually worked. And so I got into this very heavily then with my own patients, and produced a CD to teach people how to do at least beginning meditation.
So it's your CD that guides someone through a meditative relaxation period, correct?
Yes, it's a beginning meditation. It's not advanced, but it
Well, most
at least
people need
introduces.
to start at the beginning, so it's
Yeah.
probably it's probably a great place for someone. And I actually have heard some of this in the past. I've heard a bit of your meditation, and I will say it is very relaxing, and you have the perfect voice for doing this and listening to it. I also want to ask, when you started talking to your patients about meditation, what was their response? Did you get people that were totally like, "What are you talking about, Dr. Leet?" Or some like, "Yeah, tell me more"? What were your responses to that from the general patient population?
Most of them were polite,
Most of them were polite, at least, yes.
and they didn't confront me right at the time. But I did get a little bit of feedback from people after their visit that what's he trying to tell me and all that. But I did get several people that did get into this, and they all were pretty enthusiastic about how they felt after doing this.
So you got good feedback from the
Yes.
ones that actually went forward and did try some of these meditation
Yes.
approaches, yes.
Yes, and I've since sold or given away at least 500 of these meditation CDs.
Can people still get them? Do you have them?
Yes, I have them. We can make them available through
Right,
you
right.
if you want.
Yeah, we'll tell you how to do that,
yeah.
at the end of the show. So kind of talking a little bit more about the cardiovascular process and what goes on with someone. What do we need to do generally? What do we need to look out for I think we had a conversation earlier that kind of talked about as we get older, things happen if you don't stay active, if you don't have the right nutrition. Explain a little bit about what goes on in your heart when this happens.
Well, have to get into a little bit of science.
All right,
and
I like science.
Not just alternative things, but the main thing that happens is that we build up plaque in arteries, which is plaque is a mixture of cholesterol and fat and things that lines the arteries. Well, what happens? People think that they can actually strengthen their heart by exercising.
Mm-hmm.
Have to kind of dispel that as a myth, because what you can do to build up strength is weights and things like that, but you cannot actually really build up strength in the heart muscle. What you do is you improve the blood flow.
Okay.
And how you do that, when you're first born, you have arteries that are nice and pliable. And so when you exercise, the arteries expand to accommodate the extra flow that's from your exercise.
Sure.
And then when you stop exercising, then they constrict back down again
So the
to normal.
exercise is helping them get the arteries and the vessels get larger and smaller, so it helps
Right.
with the pliability.
Right,
So you can
but-
pump more blood. Yes?
But as we do a lot of the self-destructive things that we do in our lives.
What do we do?
Yeah.
We never
Like
do that
smoking,
kind of stuff.
like diabetes, like high blood pressure, like high cholesterol, all of these things.
So the stress,
yes,
eating
and
fatty
stress.
foods, maybe not having the right nutrition,
All
not
of-
exercising and
all
being
of these
active, all of
things.
those things.
What that does is it causes the arteries to stiffen.
Mm-hmm.
So if they stiffen, then when you exercise, the arteries cannot expand like they did when you were younger. And so if they stay stiff, what happens naturally then is when you exercise, then your blood pressure goes up. When your blood pressure goes up, it puts more stress on the heart. And so it's sort of
Okay.
a vicious cycle that keeps going.
And what's that called when the blood vessels stiffen?
It's called endothelial dysfunction.
Endothelial dysfunction. So
Dysfunction,
people need
yeah.
to ask their doctor about that if they get high blood pressure and different.
and not very many
symptoms.
doctors are going to know what you're talking about.
Oh, well, that's why we have the internet.
Yeah, but it stands to reason that what you need to do is do something about all of these factors that we listed to try to reduce the amount of plaque that's built up. But then the obvious thing to try to restore the arteries is repetitive challenge, which is exercise.
Okay.
And that actually is the basis of exercise. It's to restore the pliable function of the arteries to get to improve the flow to the rest of the body.
And I heard that not just exercise, you really need to get your heart pumping. I mean, it's okay to go out and do that walk, but you really need to like step it up a little bit, get that heart pumping so you have that increase of flow through your
Yes.
vessels. Is that correct?
Yes,
Yeah.
and you need to get to a good level of exercise and keep it that way for 15, 20, 25 minutes,
Okay.
something like that. But you don't just jump into it right away. You use 5 minutes to warm up, and then get it up to a plateau where you're feeling comfortably winded but not all out of breath.
Right.
And then try to sustain that level for 20 minutes. And then notice that if you're getting to the point where you can't talk easily or something like that, you're probably pushing it too much.
Yeah. So maybe back it off a little bit. And
And
if someone,
at the end of 20 minutes, then don't just stop. Use about 5 minutes to ease off.
so
And-
just ease it off slowly.
But then you need to do this at least 3 or 4 times a week
Right.
to restore this endothelial function back to normal.
So if someone came to you that had symptoms already, high blood pressure, and they didn't have any stents yet, but they felt like decreased, in breathing capacity and things like that, I understand that cardiovascular disease symptoms can be reversed. Dean Ornish has a program right now that's finally been approved by Medicaid and paid for by Medicaid for people that are on the verge of or have cardiovascular disease. So what would you tell a person? What would be your best advice to anyone, right now if they wanted to get, help with their current conditions?
Well, he has an excellent program, and but it's a multifactorial program.
It is.
It uses diet, it uses meditation, uses exercise and yoga, and really what it's about
Things, yeah.
is all of that. You need to get your weight down. You need to get exercise on a regular basis, and then consider doing stress relieving things, such as meditation and yoga, and you can very likely get along without much in the way of medication.
Yeah,
So-
I agree, and that's what I've heard and understood over the years. The good thing about these different complementary therapies that we now have, like meditation and yoga and nutrition as well, which is not a complementary therapy, that's just a piece of what we do, is that there is evidence-based research behind it. So it's not just me or you saying, hey, this is what you need to do. We can go online and we can research this and understand from a scientific basis, from an evidence-based research basis, how this helps and how meditation actually helps your system slow down, helps decrease the release of cortisol and that overactive endocrine function. If we can do these things, that's one of those factors that that could really be harmful to our health. And Dr. Leet, I told you this segment that we're doing right now goes by so quickly, and we're now at the end. But you've given some really poignant points based on your personal experience about what happened. And I mean, it's hard to say, that I appreciate the fact that you had the heart attack, but from that experience as a cardiologist, you were able to kind of relive it and understand what you needed to do for yourself from a patient and from a physician perspective. And that's such a wonderful, wonderful perspective to be able to share with our community and tell your story around that. So thank you so much for being on our show today. And
Appreciate
the very first
yes.
one. Yes,
I appreciate
yes,
it.
Absolutely, absolutely. And if you want to learn more about the research behind cardiovascular disease and others with regards to meditation and complementary therapies, please go to the link here on this screen. It's an NIH Integrative Healthcare link that will give you all the evidence-based information and research. I want you to see for yourself what this is and how it can help you. And until next time, please take care of you and take care.